Hello and welcome to my 55th book synopsis. Today I have a little bad throat and running nose, so maybe there can be an impact on the voice. Anyway, in December 2022, I read in the newspaper that Uzbekistan has said that 18 children died because of a cough syrup provided by an Indian pharma company. In March 2023, another news item popped up which said that cough syrup by another Indian pharma company is causing problems in the kidney in a country called Gambia, which is in Africa. Now, when I read those newspapers articles, I treated them like, one-off kind of article. Till such time, I decided to read this book, Bottle of Lies, Ranbaxy and the Dark Side of Indian Pharma. The book is written by Katherine Eban, Miss Katherine Eban. She is an American investigative journalist and an author. Book was printed by HarperCollins in 2019 and then India by Juggernaut in 2022. Name or this, they are calling it as an exposé, itself says what it's going to say. So is it that bad? What does this 450 pages bulky book has to say about Indian pharma? But before that, we need to understand certain things. And obviously, this book primarily talks about the drugs that are used in the US. Drugs means medicines, okay, not those drugs. So, before we understand, we need to understand two things. First is something called as FDA. Now, as per US website, FDA is a regulator for US drugs. So, what does FDA has to do? Let me read what US government says. A generic drug, the Food and Drug Administration is responsible for protecting the public health by assuring the safety, efficacy and security of human and veterinary drugs, biological products, medical devices, our nation's food supply, cosmetics and products that emit radiation. So basically FDA ensures that whatever comes to the US is safe for consumption, and they ensure it by looking at the process rather than product. That is also important point which will come a little later. But now important part is that most of the drugs which are coming in the US are generic drugs. So let us understand the second term called as generic drugs. वो क्या होता है? So as per FDA website, a generic drug is a medication. Please hear carefully. A generic drug is a medication created to be the same as already marketed brand name drug in dosage form, safety, strength, route of administration, quality, performance characteristics and intended use. These similarities help to demonstrate bioequivalence, means that a generic medicine works in the same way and provides the same clinical benefit as the brand name medicine. In other words, you can take a generic medicine as an equal substitute for its brand name counterpart. Well, in simple English, generic drugs is an approved copy of branded drugs. Simple terms. So why we are talking about this? Because before 1984, generic drugs were not permitted in US, only branded drugs were permitted. But at some point of time they realized that Indians have become experts in reverse engineering and they can produce the bulk drugs, generic drugs, at say 1/4 of the cost of branded drugs. And in order to ensure that people have access to reasonable priced same quality, then why should you not allow it? The intention was perfect and good. And that is why it was slowly permitted to bring those drugs in US, subject to you properly applying to FDA and FDA doing routine regular inspections of the manufacturing plants. Here what it takes the twist in the story. When you say that you have to give license based on what is mentioned, and then you will do audit not so frequently. Sometimes they used to do audit maybe once in 5 years also, especially out of US manufacturing centers, because they had a problem. Second, so it is claimed by the author that many Indian companies, including Ranbaxy and others, falsified the records, created dummy records, bribed people, created subpar manufacturing of the drugs, and supplied it en masse in the US. All this came out of closet because one ex-employee of Ranbaxy decided to become a whistleblower, and after his efforts, and of course by FDA etc., for continuously 9 years, Ranbaxy decided to close the case by paying an amount equivalent to $500 million in year 2011. Even if we look at that amount in today's rate, it is more than 4,000 crore rupees. You take inflation for 10 years, I think it will go beyond 8,000 crore. That's a huge amount which was paid. In the book, while author talks about many Indian companies, she also compares one company name very clearly, that is Cipla, and she says that Cipla is an exception where it actually started this, but it is doing in the correct way versus the other companies. Now the question comes as to why this happens. US is so regulated, they are having so powers, and the FDA is supposed to be a very strong regulator. Many reasons, obviously. One is the bureaucracy within the FDA, the procedures that they follow, probable corruption in FDA, inspections are required to be carried out of US, announced inspections versus unannounced inspections. In US, they don't do any announced inspection. Their officer walks in and starts the inspection. That makes huge amount of difference, and many other reasons. Author talks primarily about the US, it talks also about African countries as well. Very funny, when I was reading this book, I recollected that somewhere I have read another book on the Ranbaxy, and then I searched on the Google and found out that the name of the book which I had read earlier was Ranbaxy's Story, The Rise of Indian Multinational. This was published in 2005. It is glorifying Ranbaxy. So, one thing I can tell you that the book is enormously researched. It has taken 5 years for the author to do the research and then come out with this book. I did go into FDA website and saw names of Indian companies appearing there where warning letters have been issued and products have been recalled. Of course, there are other companies, other countries' companies as well. So we are not exception, but name of Indian companies are there. So what is the truth? Are the Indian companies or Indian pharma companies doing so bad? If we look at what happened during Corona, we provided so many drugs to other countries, we helped them. So are we that bad? I will not tell you what is this, or is this some kind of propaganda by the branded companies against the Indians? You need to figure it out by reading the book. I will not tell you entire story. Please read the book. It is definitely an interesting book. So when you read the book, you do not feel like you are reading non-fiction book. You look like you are reading a fiction book where it has adventure, drama, suspense, horror, emotions, courage, everything is there. And at the end of this, at 10 minutes already I have crossed, and I am not happy with this because there are so many things to talk. But of course I have limitation. I'll stop here. I'll be posting my book synopsis on my YouTube channel and my Facebook page. The name is Books From My Eyes, as well as on LinkedIn. If you like it, do subscribe and like it and inform your friends, and please offer your comments on critical construction, critical observations or constructive feedback is always welcome. Thank you so much. Bye bye. Take care.